Thank you for listening to Depictions Media Radio.
Hello, everyone. My name is Louise Eggersnap. I head the WHO Innovation Unit, and I'm very pleased to be here today for an event about youth innovation and youth health. And I'm very honored to be in the company of our Director General, Dr. Tedros, and two teams of amazing innovators, one team based in China and the UK, respectively. It's called the Paid Forward Contagious Kindness Team, consisting of Dr. Dan Wu and Joseph Tucker, and another team based in South Africa called Children's Voices, the RX Radio. And this is Lusuko, Talita, and Ella Ware, who will be representing that idea. And we're here for a relaxed conversation between Dr. Tedros and these amazing innovators. And it's a follow-up from the innovation challenge that we ran last year called Reboot Health, Youth Health. And Dr. Tedros at that event invited these innovators to come back and talk about how they've been faring since last time. So on that, over to you, Dr. Tedros. Thank you so much.
Thank you. Thank you so much, Louise, and very glad to have you back again, as Louise said. Dear colleagues and friends, good morning, good afternoon, and good evening to all our viewers on Twitter, Facebook, and YouTube. And thank you for joining us for today's event on youth health innovation. As the name suggests, this event brings together three things that are very important to WHO. Young people are the future, and we're committed to harnessing the energy, ideas, and leadership of young people. Health, of course, is what WHO is all about. And innovation is central to our mission to promote health, keep the world safe, and serve the vulnerable. Indeed, innovation has always been the driving force of progress in public health. Think of vaccines, penicillin, or the mapping of the human genome. But innovation doesn't just mean new technology. It means new ways of thinking and new ways of doing things that improve how people interact. Innovation is more important now than ever. Even before the pandemic, we faced many challenges in our efforts to reach the health targets in the Sustainable Development Goals. Now, we're even further behind. Innovation has given the world not one, but several safe and effective vaccines against COVID-19, although the benefits of that innovation are not being shared equally. That underlines a key point. Innovation is of most value when it benefits everyone, especially the most disadvantaged. That means the people who could benefit most from any health innovation must be included in the design process from the start. Young people are natural innovators. The Reboot Youth Health Challenge was created to understand the needs of young people today and in the future, and to use innovation and collaboration to help fulfill those needs. You have just seen the videos about the two winning themes of the Reboot Youth Health Challenge, and today you will be hearing more from both teams about what they have accomplished since they were announced as winners last year. First, the Contagious Kindness Paid Forward project in China is making free testing for gonorrhea and chlamydia available for young men who have sex with men. In many countries, testing for sexually transmitted infections is not subsidized, meaning many young people are faced with financial barriers, a lack of community support, and a subsequent increased likelihood of contracting STIs. This project is overcoming those barriers with the aim of increasing testing and improving public health. Second, the RX Radio Children's Voices project is a first of its kind radio station in South Africa that helps engage with children and young people about their concerns, fears, and perspectives on health-related matters. This innovation is linked in a radio station that's run by and for children at the Red Cross Children's Hospital in Cape Town, South Africa. With the outbreak of COVID-19, reporters began using WhatsApp voice notes and other remote recording methods to gather content. Children were also given the opportunity to work as young reporters to educate fellow children and their families on COVID-19. Congratulations to both teams for these great ideas, and I look forward to hearing more about both of them. Let's start with the Contagious Kindness Pay It Forward project, and I'm delighted to welcome Dr. Dan Wu and Joseph Tucker. Dan and Joseph, please start by telling us about where the idea for this project came from. You have the floor.
Thank you, Dr. Tedros, for the wonderful introduction. And the idea of Pay It Forward actually dates back to ancient Greece, which is a really long history. And Benjamin Franklin actually popularized paying for someone else since 1784. And he described how he lent money to others without the expectation of their paying it back, but instead with the notion that this act of generosity could ripple forward among friends. And in the past decades, Pay It Forward programs are increasingly implemented in a variety of settings and disciplines, including medical education, business, and public health. And our team started to pilot this Pay It Forward program in 2017, and we managed to complete a couple of pilot and randomized control trials as well. And we actually have a video to illustrate how the model works. So Matt, please play the video.
This is an act of kindness, a social innovation to spread love. Pay It Forward makes it possible for people in need to get a free influenza vaccine through donations from people in the community.
我收到了一张来自陌生人的明信片，上面是这样写的：现在流感比较严重，还会增加感染新冠病毒的风险。我已经支付了1针流感疫苗的费用，有需要的朋友可以免费进行接种。
People who receive the vaccine can choose to support other people either by donating money or creating messages. Mrs. Yang is one of the people who received help from the program.
在当前快节奏的环境下，竟然还有人关心陌生人是否接种了流感疫苗。感动的同时，我希望能把这份爱心传递下去。我也要捐助一位陌生的朋友，让更多的人感受到社会的温暖。
The warm generosity of many local people like Mrs. Yang keeps Pay It Forward going.
现在已经有150人通过接力种免费接种了流感疫苗，而我有幸是其中的一位。我想，正是因为大家的爱心和慷慨，才使得流感疫苗的接种得以顺利的推广。
In addition to influenza vaccination, we're also applying a Pay It Forward approach to increase chlamydia testing, gonorrhea testing, HPV vaccination, and hepatitis testing.
Thank you very much, Dan. And again, congratulations. Now I'm delighted to introduce Luzoko, Talita, and Alawea, representatives of the RX Radio Children's Voices Project, to tell us where their project idea came from. You have the floor.
Hi, thank you so much. So, as RX Radio Young and Child reporters, we have always strived on bringing children's voices to the forefront, and that is because we believe that children has a say in matters that affect them, especially on health. And so, at the beginning of the pandemic, which was last year, we saw the value of listening to children's voices, particularly on coronavirus. And so that's when we produced a public service announcement to bring information about the coronavirus to our listeners. But we also started gathering children's experiences of the pandemic and the lockdown in their countries. And we also interviewed health workers and parents to share their experiences about the coronavirus and pandemic, which we then shared on the radio and on our YouTube channel. And some reporters were even lucky to be able to continue their jobs at home, which used to boost the morale in and out of hospital. But we also have video for income, my home of play forces.
I think we lost you and the quality was not good. Alawea, I think you're the one who is presenting. Can you restart again?
Maybe one of the other teams.
Alawea?
Oh, I'm still there. Can you hear me?
Now, look, the sound is better. Please, go ahead.
Okay, I'm sorry for that. So,
Still there is a problem.
I'm sorry. Can I rather hand this question over to Lisa, please?
Sitting another place.
Okay, maybe that let's try your other colleague if, yeah.
So as our experienced child and young reporters, we have always strived to bring children's voices on all topics to the forefront. And this is because we believe that children should have a say and in matters that do affect them, particularly in health. And so at the beginning of the pandemic last year, we saw the value of listening to children's voices on the pandemic itself. And even though children were not being as directly affected, and we have seen that through this project, children were able to speak about the pandemic and the coronavirus as to what they know about the virus and how do they think it affects people. And to illustrate more, we have a video to show you.
News.
Hi, my name is Yusra.
And my name is Nasira.
And we are RX Radio reporters. We'll be talking about the Children's Voices on COVID-19 project, as well as what we've been up to since the Reboot Challenge last year.
With the outbreak of coronavirus in South Africa and the world, us as RX Radio reporters noticed that the children were not given a voice to express their experiences, ideas and feelings with the pandemic and the lockdowns that were happening, leaving them with a sense of fear and being left out of the conversation. Because while the coronavirus itself does not affect children as much as adults, we have still been affected in many ways, including schooling, feelings of isolation, and social inequalities.
With this in mind, we decided to share children's experiences of COVID-19 and help them engage with adults to show that children can help shape the response to this pandemic. Using WhatsApp voice notes, we created public service announcements, shared children's experiences, and interviewed key adult experts. We have seen that our project has allowed other children to learn more about the pandemic and lockdown, and by listening to different perspectives, this has comforted them in some way.
Since the Reboot Challenge last year, we have not slowed down in our efforts to share up-to-date information about the pandemic and to make sure children are still included in the conversation around COVID-19. Last year, August, we hosted our first ever webinar where we spoke to Professor Glenn de Grey. And soon, we will host a webinar about the vaccine rollout in South Africa.
At the end of 2020, we began recording our full shows once again on WhatsApp voice notes. And this year, we have been able to return to the studio to do live broadcasts while still following strict COVID-19 regulations. The work and experiences we collected from children throughout the country and throughout the world has also contributed to other organizations' work on the impact the coronavirus pandemic has had on children.
We'll continue to work on this project, and we believe that with the COVID-19 vaccine being rolled out all over the world, children's discussions of the coronavirus and its effects should be heard.
Thank you for listening.
Bye.
Thank you so much, Alawaya, Talita, and Luzoko. So now we will go to our discussion session, and I will ask you some questions, and I will start from Talita, Alawaya, and Luzoko. Can you also tell us how has your initiative helped children during the pandemic? And the second question is, will you expand it to other hospitals? Please.
So our initiative has helped a lot with children because it is able to comfort them and parents and caregivers in giving information to children so that they're not scared of what the pandemic is or about the COVID-19, because many times children's voices are not being listened to. And so the project has helped a lot with children. And to answer your other question, we are trying to get as more children to be a part of this project and also speak about their thoughts and not feel scared of the coronavirus or the actual pandemic.
Or Luzoko, anything you'd like to add to what Talita had said?
As Talita also said that we are trying to get as more children, and we also working with the other children from Paul, which is in South Africa, and also other children in the hospital that have been admitted. They're also part of the project as they share their opinions on how they feel. And also we have other learners that also concerned about other issues such as returning back to school on this pandemic and how they feel about the new adjustment that have been made, and especially for those who are not privileged enough to be able to meet with the adjustment in terms of lack of social media platforms to be aware, and also with the news that have been spreading, the children that don't know which resource is reliable and which source is spreading out the good and the correct information. So this is the platform where we help children to be aware and also for them to share their own opinions on the project. Thank you.
Thank you so much to your group, Luzoko, Talita, and Alawaya. And now we'll move to Dan and Joseph. I hear you have done a pilot to see if your contagious kindness approach could increase the uptake of influenza vaccines, and that you had good results. Can you please tell us more about that?
Of course. Thank you, Dr. Tedros, for the question. We did manage to complete a pilot on influenza vaccine project during a very unusual pandemic. We have three major findings from the pilot study. So it's a quasi-experimental study. And the first major finding is focused on improving the influenza vaccine uptake among children and elderly people who are at higher risk in the population. So the major finding is that in the control group, which is an out-of-pocket payment condition, we had only 37% of the participants who received the vaccination, whereas in the pay it forward group, we had a 74% of vaccine uptake, which is double of the control condition. And so this is the most significant improvement we have observed under the pay it forward condition. And the second finding we have observed is that many people in the pay it forward group pay money forward or contributed by writing a postcard messages. For example, among 111 participants who received the vaccination, over 96% of them donated something, and we collected a total of nearly $600, which accounted for nearly a third of the vaccination costs in the pay it forward group. And the last major finding we observed is that we found that the pay it forward intervention can have some positive effect on improving people's vaccine confidence in terms of people's attitudes, positive attitudes towards getting vaccination. This has important implications because there are many so much distrust in vaccine services, not just in China but also worldwide nowadays. This has important implications to both to China as well as to the global settings. So I wonder if Joe had anything to add. That's the three major findings we have.
Thanks, Don. It's well put. And I guess another observation is just sort of the implementation perspective, that a lot of interventions are sort of heavy and difficult to implement and require a lot from the local infrastructure. And with Pay It Forward, it's a lighter intervention, and just within the staff, this sort of warm glow feeling where people are being generous and giving to others. I think it can also help with implementation, that our research staff and the local primary healthcare workers who were involved in the study found that this was different. It felt sort of different compared to a lot of interventions that had been done. So there might be some implementation benefits associated with using Pay It Forward. Over.
Thank you, Dan and Joe. Thank you so much. I have a follow-up question maybe for you. How has the WHO Innovation Hub helped you to further realize and amplify your idea? I will start from you, and I will ask the same question to the other group also. Please, Joe or Dan.
Thanks, Dr. Tedros. And this is a great question. We're so grateful for the support from the Innovation Hub. They came to us and said, how can we take this to the next level? Pay It Forward works in person. What are you thinking about next? What is the end user thinking about? How can we optimize this? And so we engaged in a community process where we talked with local folks. We talked with Innovation Hub experts on user design and developed a mobile app. So the Innovation Hub helped our team to create a sort of digital version of the same idea. And this mobile app is now feeding directly into ongoing research. And so the Innovation Hub, I think it's been a huge benefit for our team. And we're also really grateful for the Social Innovation and Health Initiative that's supported by TDR. So this is a really an emerging field of social innovations, and this opportunity to be a part of a larger network and to benefit from others like Children's Voices. I think it's really inspiring to hear what Children's Voices has done to listen to vulnerable young people all over the world. So interested to hear the perspective from the Children's Voices group on this as well. Over to you.
Thank you, Joe. Dan, would you like to add to that, or please, if you would like to, feel free.
No, Joe covers almost everything. Thank you.
Okay, thank you. So the same question to Alawea, Talita, and Luzoko, how our WHO Innovation Hub helped you to further realize and amplify your idea? Please, any one of you would like to start?
The WHO has helped us with this with the case study with WHO and also the other UN organization throughout the webinars we had. And also we also had our own webinar with Professor Brenda Gray, where we discussed about the vaccine and also the other concern we as the youth had. So the WHO also helped us very much to be able to adapt and also to discuss other concerns with joining the other webinars. I don't know if my teammates have anything to add on.
Yeah. So anything, Talita or Alawaya?
Yuzuka has actually said everything, but I just wanted to say that the WHO has given us a great visibility for other webinars such as this to speak about children's voices on COVID-19 and possibly hear what adults think of our project.
Yeah, thank you so much. I'm glad we're helping and working together. Then, of course, you may need more support, and we would like to know that. So, can you tell us what your next plans and how can we at WHO continue to support you? Luzoko or Alawaya or Talita, anyone you would like to, please?
So the biggest challenge that the project is faced in the beginning was how to create voices, or let me say gather the voices of children, as we were unable to go into studio and take recorders out in the communities because of COVID. But luckily we were able to use WhatsApp voice notes to gather content, and many people in South Africa has access to smartphone to be able to send their experiences through WhatsApp voice notes. And another challenge that we're currently facing is our support and funding, as it does take time and money to produce and distribute content that we are making for our Children's Voices project, as well as other projects as well. So if you are interested in supporting us, please do go on to our website at www.rxradio.co.za. There you'll find some instructions on how to help us distribute and get funding for our project.
Thank you, Talita. Luzuko or Alawaya? I think we lost Alawaya. I don't see her online. But Luzoko, would you like to add, Luzuko? On what the next plans are and any support you need from WHO?
The next plan, we're going to be having our next webinar with Dr. Sambot. And I think the challenge that we had was just getting more voices from the children and gathering interviews as the pandemic has stopped us from coming to the studio. So in South Africa, we have the level. Right now, we're on level 3, so we are able to come to the studio with a maximum number of, let's say, 50% in the capacity. So we are able to get in the studio and interview children based on their concern and also get more voices by following the protocols. Thank you.
Yeah, thank you, Talita. Thank you, Luzuko. Now, the same question about your next plans and any support you need from us to Dan and Joe, please.
Thank you. I could go first, and then Joe, perhaps you can add if I miss anything. So the next plans that we're doing is that, first of all, we are now planning a pay-it-forward project to improve HPV vaccination among young girls in China, because that's there's a really huge gap here. Only 2%, less than 2% of the key communities in China are now vaccinated against HPV. And we want to see whether this pay forward strategy can also be effective in terms of improving HPV vaccination uptake in the Chinese setting. And the other thing we're currently doing is doing a implementation research to evaluate the implementation process, as well as to better understand the mechanisms of pay forward in terms of improving gonorrhea and chlamydia test uptake among men who have sex with men. So in terms of scaling up and replicating the model in other places, we would need to understand better how it works and what are the mechanisms behind the model that makes it work. And in terms of how WHO can help us, I think we are really not sure whether this model can be replicated or applicable to other settings, for example, African or other low middle income countries. So I think WHO can play a bigger role in terms of how we can make this model or replicate it in other contexts or settings. That's from me. And anything you could add, Joe?
Thanks, Don. I think the other point in terms of thinking about pay it forward in the future is to think about how we pay for health services. So oftentimes when there's a research study, we give incentives for people to participate, and there's sort of an artificial demand to have the vaccine or the test. And then as soon as something is approved by a regulatory agency, oftentimes there's a fee associated with it. There's a fee associated with the test. There's a fee associated with the vaccine. And then you see a decrease in sort of community engagement and in community demand. And pay it forward is sort of a different approach where we could potentially build in some community engagement and allow people free access to services sooner. And so I see this as helping countries or governments to be able to accelerate universal health coverage and provide free services. We're not going to get to UHC in a short period of time. It's going to be a stepwise process. And this approach could be one tool or one example of how to make services completely free and more community engaged and grounds up, and build in more community support for them. So I think it would be fantastic to talk with the WHO about how pay it forward might be useful in the context of UHC pilots in other low and middle income countries, or how do we make free services more widely available at this interface between research and routine programs. And Don's nicely laid out how HPV is another place that we're excited to move into as sort of at the intersection between sexually transmitted diseases and vaccine work, and thinking about how do we scale this up, how do we work with governments and providers to transition this into sort of something that could be more enduring. Over.
Thank you, Joe. And maybe while you're there, ahead of the International Youth Day, what's your advice for other youth innovators? Please, and if Dan has, she can also address the same question.
I think with youth, to go back to your original comments, Dr. Tedros, youth are the future. There's so much creativity. There's so much potential. And really, for young people today, I would say be generous and think about the local community. And I'm not talking about toxic positivity and sort of putting a positive spin on everything. It's really more how can you strategically give to others in a way that amplifies generosity and spreads through a community. And there's so many exciting mutual aid programs that are not just youth making a contribution, but youth leading these programs, youth designing them, and So I'm really optimistic that even though there are many challenges with COVID, that Youth Day can see a real renaissance and many great opportunities for youth to play leadership roles. Don, any other thoughts about youth and sort of what youth can do?
Yeah, I completely agree with you, Joe. Be generous, and as the Chinese proverb said, do good, however small. And I do believe that the future is belongs to the youth. So that's it. Thank you.
Thank you, Dan and Joe. So the same, maybe I'd like to ask same question to Alawea, Talita, and Luzoko. Ahead of the International Youth Day, please give us your advice for other youth innovators. Any advice you have?
I would like to say that the youth, we are the future, and our voices actually, because I know it sounds like I'm speaking a lot about our project now, but our voices should be regarded and our opinions should matter, and we are the youth. We can do anything but good, and we should always try and help each other no matter what, and also try and bring the world to a better place.
Thank you so much, Talita. Anything, Luzuko?
Yes, as Talita said, we as the youth, we're trying to bring the world to a better place. I also say that we as the youth, the power is in our hands, and we are the future leaders and the future architect of this world. So yeah, I think it's all up to us on how we should get together and united and make the world a better place.
Alawea still or not, she can add to this if she would like to. Is she online?
Unfortunately, she's off due to technical problem.
Yeah, very, very sorry about that. But please let her know that, let her know about our appreciation and respect for your team, including her. So these are some of the questions from my side. And now we have some questions from viewers. As you know, we have many viewers now through multiple of channels. And my colleague, Luis, will read some of the questions we have from viewers. Please.
Great. So
wait. Okay, go on.
Good. Thank you so much. So there are comments concerning the interaction with children in poor settings and the importance of that. So maybe you could elaborate especially for, I think, children's voices on whether you're doing some extra effort to reach children living in vulnerable communities. And should I add another question while I'm at it?
Okay, I can address both.
So there's another question which is about how much digital technologies were helping you in the realization of your respective projects. I know these are mostly social innovations working with the human fabric and the human interactions, but to which extent do you think digitalization could actually, or digital tools will be helpful in taking it forward and further? Thanks.
Okay, thank you. Dan, would you like to start? And Joe, please.
Sure, I could take the digital technology question. In terms of how the digital technology helped with the project, we have co-created part of some components of the pay forward intervention. For example, we conducted a crowdsourcing project to solicit community inputs into designing some components of the intervention. For example, community messaging, postcard, how to design the postcards that are more engaging for the community. So that was done mostly via the digital platforms. And we are also working with the WHO Digital Health Innovation Group, who helped us digitalize the Pay Forward platform that could provide remote platforms to those participants who are interested in participating and lower physical barriers or geographical barriers who might be interested in being part of this in the future. And we're also thinking of ways of using the digital technology to do more engagement activities with our future community participants. There is a huge potential of using various digital technologies in our future project. I think that's from me. And Joe, would you like to add anything?
Thanks, Don. And I agree that sort of community engagement and micro donations and crowdsourcing, all of these things can be enhanced through digital technologies. The other part of the digital side of this is that there are ways to get to co-create messages for more vulnerable groups using digital technology. So how can we reach people with disabilities, people that don't speak the main language in a country? There are all sorts of marginalized groups that may be easier to access through some digital approaches. And so, for example, gay men in the Chinese context, many are experience stigma and discrimination. They're comfortable talking to others and discussing about this online. And this is a way to reach men and have their voices heard as well. So digital tools, I think, can really expand the scope of what's possible and create some exciting opportunities. Over.
Yeah, thank you so much. And Talita and Luzuko, the two questions, maybe if you would like to repeat them, Luis?
Sure, with pleasure. So one question was around to which extent have digital tools, digitalization helped your innovation? So combining your innovation with some digital platforms or tools like voice notes, etc. And the other question is around to which extent you have taken extra efforts to involve children living in poor or vulnerable settings as part of your project.
Okay.
Hi. So I'm Chris. I'm also part of the team. I'm just going to jump in here for this answer. But basically, like Louise said, and like Talita and Liz have said, that we've been using WhatsApp voice notes. And luckily, in South Africa, smartphones are quite common in many places and many areas of the country. So we've been able to with kids using their parents' smartphones or whatever to collect these WhatsApp. So WhatsApp has been a great platform to collect these voice notes. It's not the best quality. It's not like radio perfect quality, but it's amazing how it's worked so well in terms of that connection. We've also been using things like Zoom when we can, and that. I think a big challenge that's kind of out of our hands is the fact that our reach depends on if people have access to data, which is something that is very expensive in South Africa. So we've been trying to get zero-rated access to our website so that people can listen and view our website and view these stories without using their data. And then also a lot of our reporters come from a variety of communities, largely from Cape Town, and these include sort of underprivileged communities. So we've been able to connect with other children and with other people from a variety of communities. So I think, luckily this technology has been available at the start of the pandemic to be able to connect like this and collect these stories using this method. But we still need to work on ways and finding support in order to sort of fund the expansion of these technologies. Another thing we've done now is for basic training, we've actually managed to get a couple of tablets that we can distribute to the kids who are part of the training, so that they can connect virtually via Zoom to be able to be trained without us having to go in and doing that. So even virtual training is possible now, thanks to that.
Thank you so much, Chris. I think we're on time, and I will now give the floor to Louis to reflect on Innovation Challenge and way forward. Louis, you have the floor.
Thank you so much, Dr. Tedros. And thanks again to our innovator friends in South Africa, China, and the UK. And congratulations again for winning the Reboot Health Challenge last year. So reflecting on this, we ran this challenge as a pilot and as a test of how we were going to go about innovation in health in WHO. And we learned a lot. And we also identified these two amazing social innovations along with a lot of other great ideas. I just want to pause a little bit on the social innovations that we see here today, because I do think it's quite fascinating to see how far you can get with simply working with the knowledge we have about how people interact and how this human relationship, if you re-engineer how people engage, that you can actually increase the uptake of testing for dangerous diseases or expand vaccination quite significantly. So there's evidence of the effect. And also you can increase the confidence among children. In the case of children's voices, what you've done is really, in a way, turning the pyramid upside down, giving children the microphone so that children can ask the questions, tell their stories about how they're affected when they're hospitalized, how they experience the pandemic, etc. And that is informing policy. It's informing adults about how children experience being hospitalized, how they experience the pandemic. And it's improving our relationships and having impact in lives. So that's really important. And so social innovation matters. And combined often with technology or digital solutions, it can have even greater impact. From the challenge, we learned a lot. And we also learned about WHO's best value add in this space. And we believe going forward that we need to put the main emphasis on leveraging our global health leadership as WHO and as a facilitator, convener, and matchmaker in this space. And that means using WHO's role and presence in countries and direct dialogue with governments and ministries of health to better understand and help highlight the health needs and the demand for health in countries, and then link and do the matchmaking with that need, with the supply of innovative solutions. And as we do that, it actually implies new ways of working and new partnerships where we will partner with innovation funders and aggregators who do run innovation challenges very well. This is something they have perfected. They do a fantastic job in running large innovation challenges through which they identify the innovations, assess them, and then help identify the ones that are most viable for a given health need. So this division of labor and WHO are working with partners in linking the demand that we see with the supply and the pipeline that they can provide is really a strong way forward. And in addition to that matchmaking, we will also support the scaling of innovation in countries. So that's where we see WHO's main value add, the matchmaker between health needs in countries with innovative solutions, and then helping to accelerate impact by scaling those solutions in countries. Thank you so much, Dr. Tedros, for leading this conversation
Thank
today.
you. Thank you, Louise. Yes, Matchmaker, WHO would be happy to connect the world so we can make a difference together. So with that, we're now reaching our closing. But since we have a few minutes, if there is anything you would like to say before we close, before I go to the closing, I would like to give the floor to all of you. Anyone who would like to say anything you would like as a closing. So anyone who would like to start?
Thank you for having us. And I would like to just say that in order for us to continue with our project and distribute content where children speak about their knowledge on COVID-19 and generally what children feel, there is the need for funding, and you can also go to our website at www.rxradio.co.za, and there you will find some instructions on how to fund us and keep this great initiative going for many years possibly.
Yes, I fully agree. Let's keep this great innovation going. Thank you so much, Talita. And anything else? Any closing you would like to make? Any statement, any message? Please. Dan, Joe, please.
Thanks. One other additional announcement about innovation challenges. The Wipro regional office of the WHO is going to be organizing an innovation challenge for, this includes both technological innovation as well as social innovations. And for those who are interested in this space within the Asian region, keep your eyes peeled for that announcement. It'll be coming in the next weeks, but I think this is a really exciting space. And as has pointed out today, you look and see sort of the power of local innovation, the power of youth, young voices. It's really inspiring, and excited to be part of this. And thanks again for including Pay It Forward in the program.
Thank you. I fully agree. We need to utilize the power of youth. Anything else you would like to say before my closing?
Yeah, I just want to jump in and say thank you again.
Jump in, yes.
And we're really excited to kind of keep these types of projects going, because we believe that for us, children and health innovation is really important. So we're excited to continue connecting with different people and to connect with the WHO to make sure that we keep going and keep that all of us keep reaching children and the youth around the world.
Thank you, Chris. Thank you so much. Anything else?
I really appreciate the opportunity. Yeah, thank you. I really appreciate the opportunity. I would like to also take this opportunity to invite anyone who are interested in doing pay it forward research or practices or use it to improve health service use. Please do feel free to reach out to us. And we're excited to expand it in every corner of the world. Thank you.
Thank you so much. I'm really glad to hear that you're always ready to share your experience. These are two very innovative ideas that can be applied in, many parts of our world. Of course, adapting it to their situation. So thank you so much for your offer to help others. So with that, thank you so much again. Thank you to Alawea, Talita, Luzuko, and Chris, and also to Dan and Joseph. Thank you for your inspiring example, and I sincerely hope that both of your projects will not only continue to succeed, but will continue to motivate others. I also want to thank Luis and our other colleagues here at WHO for their work. We have Alex here, who has been working on that actively and in supporting the Reboot Youth Health Challenge, and for leading WHO's work in leveraging the power of innovation for health. This short meeting has also only provided a snapshot of the potential of youth-led health innovation. And on Thursday of this week, the Youth Lead Innovation Festival will take place on International Youth Day in celebration of innovative youth-led solutions for our world's most pressing challenges. The message is clear. Youth must be key collaborators and drivers for a healthier future for us all. Together, we can achieve health for all. Thank you so much again, and I wish all of you a very happy International Youth Day. Thank you so much.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.